Dr. Laxmaiah Manchikanti, the Medical Director of the Pain Management Centers of Paducah and Marion, answers the question, what is interventional pain management?
Each specialty in medicine has an official definition. These definitions come from an organization called the National Uniform Claims Committee. As with any other specialty, this committee derived the definition for interventional pain management after consulting with scientists, physicians, patients, and health policy makers. Essentially, to understand easily in layman's terms, interventional pain management is a specialty of medicine. Remember, it is a specialty of medicine, concentrating on the diagnosis and treatment of pain by applying various types of treatments, but mainly interventional techniques. In simple terms, these interventional techniques not only manage difficult cases and occasionally simple cases where surgery is not indicated or other modalities have failed, but also identify the cause of pain which has not been identified in the past using traditional testing, including physical examination, X-rays, including advanced technologies such as MRI or CT scanning, as well as nerve conduction studies. In interventional pain management settings, the pain is treated with a combination of various techniques addressing multiple aspects, essentially when other types of treatments have failed to provide any significant improvement. In interventional pain management, we apply all traditional techniques, including physical therapy, education and behavior modification, drug therapy, structured exercise program, but all of them applied together in conjunction with interventional techniques to provide maximum effect, or you may want to say, best bang for the buck.
What are the goals of interventional pain management?
As all other physicians and specialties in interventional pain management, we have many goals. While our major goal appears to be to relieve the pain, but it is the relief of the pain in conjunction with function. Of course, the most successful patient is the one who goes back to work, enjoys family life, and does not use any medications. In many cases, as you well know, that is not achievable. The majority of patients who come to us consider us as their last hope. They have seen many doctors, had many surgeries, and in the majority of cases, they are already disabled. Chronic, persistent, intractable pain is a condition which might not be cured. We can only cure pain in some cases, but in the majority of cases, we can manage it. Our dictum is to improve the quality of life by reducing pain to a tolerable level and increasing function so that you can enjoy life and carry on activities of daily living, even though sometimes they may be very simple, such as going to a bathroom, going to grocery store, playing with kids or grandkids.
What does managing pain mean?
Chronic pain may be compared to high blood pressure, diabetes, COPD, emphysema, and other conditions. For example, let us say you take insulin for diabetes every day. You can't expect one day's insulin to provide you with a cure or even control your blood sugar for a whole week. The same goes for high blood pressure. If you miss your pill one day, you are going to have an increase in blood pressure. That may lead to multiple other problems. The same happens with the chronic pain. So we need to continue to manage it on a regular basis by modifying the activities you do, changing the way you think about your pain, reducing your emotions, performing a structured exercise program, taking medications when necessary, and undergoing interventional techniques as needed, not on a daily basis, but once in 3 months, 6 months, 1 year, however, whenever it is medically necessary.
Dr. Manchikanti, please explain the differences between acute and chronic pain.
As human beings, all of us, and sometimes even doctors, forget the difference between acute and chronic pain. These are two entirely different concepts, or you may even call entities. Acute pain is something you experience on a daily basis. Examples of acute pain would be when you put a finger on a hot stove, somebody puts their foot on your toe, you unconsciously hit your elbow, you have a kidney stone, or give birth to a child. Acute pain means that there is something wrong with your body and it needs to be corrected or fixed. But chronic pain is not like that. It is long lasting. It continues after normal healing has occurred or should have occurred. Occasionally, chronic pain becomes a disease in itself. Generally, we believe that chronic pain or persistent pain lasting for 6 months or longer that does not respond to traditional medical or surgical treatment. Some even believe it may be just 2 or 3 months, or generally anything about 3 months. Please remember, chronic pain may be there and you may still have acute episodes in the same region or acute pain that is unrelated to your chronic pain.